Okay, so we are live. Good afternoon, viewers. Good afternoon from wherever you are, whether you're watching us on YouTube or Facebook. Welcome to the program, Meet the Press with Lovejoy. The name is Lovejoy Mtumbiza, and on the program we talk about everything and anything from anyone from everywhere. The whole emphasis about this program is to bring people together to talk about their issues, and we invite you if you've got any issues that you want to talk to us about. On the program today, I have got two gentlemen here. The other one, I'll let him introduce himself. The other one, he was here last week. We were talking about disability issues, but today we are coming out with different issues as well. Taps, welcome back to the program. Good to have you, my brother.
Thank you. Thank you, Lovejoy. Good afternoon, viewers.
Okay, I know today you're wearing a different hat from the one that you're wearing last week. So I would want you to briefly talk about yourself in this context before I introduce the topic.
All right. Good afternoon, ladies and gentlemen. I am Tapiwa Tsikai. I am a trustee for an organization known as SHAZ. SHAZ is an abbreviation that stands for Spina Bifida and Hydrocephalus Association of Zimbabwe. Basically, SHAZ is a support system that we formed as people who are concerned about Spina Bifida and Hydrocephalus in Zimbabwe. I am in the organization as a trustee, and I also have Spina Bifida and Hydrocephalus. And then the organization was founded by Dr. Luxton Jokonya, who is one of the panelists, as well as Miss Debbie Kennedy Stedman. Yeah, basically.
All right. Thank you so much, Traps. I will be coming to you for more information on the topic today. So today we're talking about hydrocephalus. This is something that I would want Dr. Luxton Jokonya, who is a neurosurgeon, to talk about more. But I'll let him introduce himself, and then we can take it from there. Doc, welcome to the program, and kindly introduce yourself and the kind of work that you're doing.
Thank you very much, Lovejoy. Good afternoon to the viewers. So, like you said, my name is Dr. Luxton Jokonya. I'm an adult and pediatric neurosurgeon. I work at Harare Hospital, and I'm also a lecturer with the University of Zimbabwe. And I'm also a founding member of the organization called SHAZ, which we're also going to be talking about. Thank you.
All right. Thank you so much. I know because of time, Doc, probably what I'd like to say. But before we go to the program, I would also like to take this opportunity to thank healthcare workers who are giving their all during this coronavirus pandemic. They are doing a wonderful job. We thank you and we honor you, and please do not get tired. Right? So, Doc, let's talk about hydrocephalus. What is it about? Because this is generally a big term, and it can be very intimidating to someone who doesn't know about it. What is hydrocephalus? Please just explain to us.
Okay, yes. So hydrocephalus is a condition where you've got an abnormal accumulation of fluid within the brain. So this condition can affect both adults and children, but it tends to we tend to talk about it more in children, but it also affects adults as well. So basically what happens is you've got this buildup of fluid within the brain. So in children, it manifests usually they tend to have a head that is growing very fast. And then they have other signs such as things that we call sunset eyes, where their eyes, they're not able to look up and you can actually see the white of their eyes. Then they tend to have also dilated scalp veins. So all this, the accumulation of fluid in the brain affects the development of the brain and many other things, and can get to a point where it can actually cost them their life. So in a nutshell, that is what hydrocephalus is. It's a neurosurgical condition that is usually managed through surgery, where we can do various kinds of operations, but the most common one is the implantation of what we call a shunt. So this is basically where we put in some through an operation, we allow drainage of that fluid to go into another space within the body, let's say the abdomen.
All right. I've seen a lot of people with that condition, but mainly I've seen them as the children. So is this something that someone is born with, or is something that you can develop at a later stage?
So some are born with hydrocephalus, and some can develop hydrocephalus. So it's caused by many things. Sometimes it can be caused by infection. So some people, after getting an infection in their brain, it can then block the flow of fluid in the brain, and then they have that accumulation. Or it can be caused by a bleed into the brain, or sometimes brain tumors and things like that.
So it affects everybody, despite it.
Yes, so it can affect virtually anyone.
All right, interesting. Maybe let's talk about it being a life threat. Is it life-threatening? Can someone die from it? Can someone live with it?
Yes, so it can be life-threatening, but so what happens is when you've got this abnormal buildup of fluid within the brain, it puts pressure on the brain. So the brain does not develop well. So if the treatment is delayed, like what normally happens with most of our patients in Zimbabwe, they tend to present very late. So sometimes when the head will continue to grow up until you can operate, up until the child or the person gets operated on. So sometimes you've got children with very, very large heads because the condition was probably neglected and the head keeps growing. So it then becomes to a time where it then actually becomes life-threatening. So sometimes, even if when it is not life-threatening, the longer it takes before the patient is treated, the worse the outcome is going to be. So it's usually a condition that needs urgent treatment. So one of our concerns, which is part of the reason which has prompted the formation of SHARS, is that we've got a lot of these patients. It's a condition that most people do not know much about yet. So we've got a lot of people that are affected that are not getting treatment. And by the time they come for treatment, they've got very large heads, or sometimes their outcome is not going to be very good because the treatment was delayed. So this is in children. By the way, it occurs in adults because the skull is no longer pliable. It is fixed. So when it occurs in adults, it quickly becomes life-threatening because the head does not have room to expand and accommodate that pressure. So it quickly becomes very life-threatening in adults. So they can actually have episodes of sudden death.
Interesting. Briefly, let me do that. I don't want to keep you there, just listening to talk. At what stage were you diagnosed with hydrocephalus, and how did you accept it? How did you grow up with? If maybe you were diagnosed, what did you do growing up, or what did you do after being diagnosed?
All right. I think I was diagnosed with hydrocephalus at birth. As Doc said, it's a neurological defect. Some children are born with it. Usually, hydrocephalus is associated with a condition known as Spina Bifida. I think Doc is the best person to really explain what Spina Bifida is. So yes, basically I was born with it, and there was no choice about it. Whether I accepted it or not, it was already part of me. I mean, what else could I have possibly done?
Okay, but did you have any complications growing up?
Lucky for me, the type of hydrocephalus that I have is called a dormant form, meaning that I have it, but it does not affect me in any way.
Okay, interesting. We apologize for some feedback that's coming out. We are not sure where exactly it's coming from. I believe maybe from one of our gadgets. Please bear with us. Right, I'll come back to you. Is this hereditary? Can it be passed from generation to generation? Can it be passed from one person to another? Doc?
Sorry, the connection is bad. Can you come again?
All right, I'm saying, is this condition hereditary? Can it be passed from one family member to another?
Oh, okay, yes. So hydrocephalus, like I said, has got many different causes. So some of the causes are hereditary, but the greater part of them are not hereditary. So it can occur virtually on anyone, depending on whether they actually do have the causes for it. So the form that Tapia has described is rarely, when someone has hydrocephalus, it may undergo a process that we call the hydrocephalus is arrested. That means it's no longer progressing. So for one reason or the other, if the hydrocephalus was being caused by, for example, poor absorption of the brain fluid, which we call CSF, and then for one reason or the other, that opens up and it starts being absorbed, then the hydrocephalus sort of resolves. So that would be what we call arrested hydrocephalus. But that's a rare occurrence.
All right. Well, as I was looking around before we came to the program, there's something that I noticed called normal pressure hydrocephalus. Can you please explain to us what that is?
Yes, so normal pressure hydrocephalus is a type of hydrocephalus that occurs usually in adults. It actually occurs exclusively in adults, particularly the elderly. So it can manifest in different ways. So the common ones is they start getting some degree of dementia, and they may start having problems in walking, in balance, and then they may also um, have headaches or things like that. So, but normal pressure, so it's one of the correctable causes of dementia. So it's actually important that when adults start getting dementia or problems with balance or things like that, they get checked early. So they may also have problems in in bladder control as well.
Mm-hmm, mm-hmm. And then let's talk about also, the type of surgery that's needed. Uh, how does one with detecting it? How does one detect it? And after that, what kind of treatment or surgery is done, and how complicated is it?
Okay, so in terms of how someone can detect that they have hydrocephalus, so it presents in different ways in adults and in children. So I'll start off by children. So in children, the most common presentation is when you see a child suddenly having an increase in their head circumference. So their head is growing, begins to grow more than normal or faster than normal. So sometimes you can hear mothers say that, their child used to be wearing this hat, and after a few weeks or days, they can no longer fit that hat. So that shows you that the head is growing very fast. And there's also the soft part of the head that we call in Shona Nova. So most of the time, it's usually level with the rest of the scalp, or sometimes it can be slightly sunken, and it sort of rises only when the child is crying. But if it is continuously sort of elevated or bulging, that can also be a sign that you've got increased pressure within the brain. And then there are other signs that will then ensue later on, like the child can become lethargic or poor feeding and things like that. So in adults, the most common presentation is they can have severe headaches that tend to be generalized, and they can have their vision becoming affected, and then they can have alterations in the level of consciousness. They can become confused and then end up being drowsy and eventually comatose. So these are the most common presentations. So once you see any of these signs, it's highly advisable that you see a medical personnel and you get checked up so that this can be diagnosed early. So the earlier that this is diagnosed, the better in terms of the outcome after treatment. So the treatment basically for hydrocephalus depends on the cause of the hydrocephalus. So usually we just target to treat the cause. If it's caused by a tumor, we may have to operate on the tumor and remove it. If it's caused by a bleed in the brain, we can deal with that. Sometimes even after the cause is dealt with, or sometimes we may not find a cause still. So in all those cases, we then still need to be able to divert the CSF. So we do an operation where which we call a shunt operation, where we install a shunt to be able to drain that excess fluid. Or sometimes we can then do what we call ETA or endoscopic third ventriculoscopy, where we introduce a small camera into the brain and then we open up spaces for the fluid to flow. So these are the most common ways in which we manage hydrocephalus.
Okay, all right. Maybe just hearing about it, the way people obviously do not want things inserted into their body part, into the stomach, into the head. Let's talk about those tumors you were mentioning about. Can they develop into cells?
Sorry, the sound is very bad. I can hardly hear you.
All right, I'm talking about the tumors that you're talking about, right? I'm asking, is there any chance or do they have chances of them developing into cancer cells?
Chances of developing what?
Into a cancer.
Or from the hydrocephalus?
Yes.
Okay, no, so hydrocephalus itself does not cause cancer, but it can be caused by brain cancers.
Okay, all right, okay. I'll come back to you. Let's talk about Charles, right? You are in the forefront, you are a trustee there, and you're working with people with this condition. Let's talk about the work that you're doing. What exactly are you doing? How are you helping people with this condition, and which age groups or maybe group of people are you targeting?
Basically, as an organization, we are working towards bettering the quality of life for people with spina bifida and hydrocephalus in Zimbabwe. SARS is a very young organization which we formed earlier on in 2020. As such, what we are primarily focusing on are surgical interventions where doc is performing operations on children with hydrocephalus as a way of correcting that condition. So as a result of that, we have what are called as surgical camps, whereby doc and the team of medical experts operate on a large number of children over a period of a week or so, free of charge. So I think Doc is the best person to really explain what goes on within these surgical camps.
Mm-hmm. Okay, Doc, maybe you can put more on this section. Who are you targeting? Who are you working with?
Yes. So what's been happening is, like I say, so sometimes our hospitals are overwhelmed with the number of patients that come through, and we're not able to operate on as many patients as we would like to. So what we've come up with is these surgical camps where we have extra theater time, where we are able to operate on a number of patients on consecutive days. So we've partnered at the moment with Rotary Club, and we've got other partners as well that come in to assist, like Celebration Health as well, with funding to be able to get the various things that we need for these operations to occur. And so far we've done a number of these camps at Harare Central Hospital, where we are able to operate on children with hydrocephalus and also with spina bifida. So at the moment, we've got a camp that is lined up first week of December, so starting from the 30th of November to the 4th of December, where we will be operating on these babies as well. So we've got various partners that are coming in to assist us to be able to bring the things that we need to have these operations to take place. So we find that there's a number of children that are affected with this condition that are not able to access healthcare for various reasons. So we are targeting this so that we can be able to assist them. So I can also maybe take note at this point to say that if we do have such, they can get in touch with us, and then we can also see how we can assist them.
All right. So where are these camps going to be held? Are they dotted around the country or maybe one central point?
So at the moment, we've been doing them at Salim Mugabe Hospital, formerly known as Harare Central Hospital.
Mm. And it's strictly for children, not the older guys.
Yeah, so at the moment, we've been targeting children because they seem to be the most marginalized group that really need this kind of care, because the majority of them will not even be able to live up to adulthood if we're not able to operate on them early. Yes.
Okay, I was going to ask about the life expectancy of a child born with syphilis. Please just briefly explain to us. Are there any chances of the child living maybe into normal adulthood, right? Into 50s, 60s?
Yes. So with most neurosurgical conditions, they're extremely time dependent. So from the time that the disease process starts to the time that it is managed, that's very critical and important. So the longer we delay, the worse the outcome is going to be. So you find out that if you have a child with hydrocephalus and they delay getting treatment, they will is going to affect on their intellect. So it may cause them to have delayed developmental milestones, and they may never be able to reach their full potential. But if it is managed early, they can actually be able to lead as near normal lives as possible. Um, Same with Spina Bifida. We know that for these conditions, if you do not do anything at all, the chances of them living beyond 5 years is very, very slim. But if you are able to operate on them, they can live much longer. Tapia is a good example of that because he does have Spina Bifida and Hydrocephalus, but he's an adult now because he managed to get treatment quite early on. So we've got quite a number of people, even here in Zimbabwe, who are living quite fruitful lives despite having these conditions for the sole reason that they were managed very early on in their lifespan when they were still very young. So yes, to answer your question, if they're treated early, they've got a very good chance of living as near normal lives as possible. And sometimes with spina, if they do not have a lot of complications, they may actually have normal intelligence or higher than normal.
Also, maybe on the aspect and then health aspect, do people with these conditions maybe or maybe are they easily attacked by other diseases, by other infections? Maybe are they susceptible to getting ill more frequently than say normal people?
So when you have hydrocephalus and you have an operation, maybe the shunt operation that we're talking about.
Hello, can you please come again, Lovejoy?
Okay, I'm asking. Okay, Tapio, I'm asking Doc that people with hydrocephalus, are they prone to diseases? Are they more prone to diseases than, like I said, normal people? I'll come back to that.
Yes, so if I may answer that. If someone has spina bifida and they are not operated on, they are at a very high risk of getting infection. So they can get infection on the spinal defect itself, and which can complicate to get meningitis and things like that. So this is the usual cause for mortality and morbidity in these children. So yes, they are at an increased risk of infection. However, if they are operated on, then that risk reduces drastically.
All right.
Yes, and then for hydrocephalus as well, they don't necessarily have an increased. I mean, the shunt can become infected, but then again, there are things that we do about it. We can replace the shunt or things like that as well.
Tapio, the reason why I put normal people in court because I want to talk about the stigma associated with the hydrocephalus. Growing up, did you face maybe resentment from the community, or from the schools? Did you face any form of stigma?
Hello, can you please come again? I can't hear what you are saying.
Okay, I think you're on a bad network, but let me take that again. When you're growing up, because I'm talking about stigma, when you're facing stigmatization from the society, from the community, from your friends, maybe from school as well, did you face any form of discrimination?
Stigma and discrimination are synonymous with disability. This is something that you don't only face as you are growing up as a child with disability, but you face it throughout your whole life. Even up till now, I'm a professional. I have an okay standard of living, but I'm stigmatized. People see me walking down the street and they still stigmatize. They look at me funny as if I'm some sort of clown or something, which is very disturbing. So, really, what needs to happen is that we need to educate and enlighten people that disability is part of human diversity. It's part of life. There's nothing wrong with me. I'm just different from everyone else. That doesn't make me less of a person. So you find that as a result, stigmatization is a very huge problem. In fact, that is one of the barriers, the hugest barriers we have to inclusion is stigmatization of people with disabilities, people with spina bifida like myself. So yes, definitely I have faced lots of it growing up and still now. And I'll probably face it tomorrow and the day after
All right.
that.
Okay, Tats and Doc as well. I don't know if you pick this up. Is this a disability? Is this a form of disability, or is it a condition just like, let's say, hypertension or other forms of the conditions, various conditions that we have? Tats is going to for this.
Sorry, you're asking if hydrocephalus is a form of disability.
Yes.
Okay. So hydrocephalus in itself is not disability, but it can lead to disability if it is not treated early. So, like I said, it's because of the buildup of fluid in the brain, which can cause pressure, and that can cause the brain not to function normally. So that can lead to some forms of disability. However, if it is treated early, then, like I said, they can lead almost near normal lives.
Mm-hmm. All
Depending
right,
on the
Doc.
complications that they get.
I know you talked about wanting to go somewhere. So, in the interest of your busy schedule, I'll just ask you to maybe, if you can free, provide your details so that those people who want your help right now or who would want to come for the also, we did talk about the dates for the sexual clinic. Right? Would want to know when are you having this? I know you talked about arrest in the hospital. That thing is there. So when are you having this? And can you provide those who want to get in touch with you regarding this issue can talk to you?
Okay, so the dates of the camp are from the 30th of November to the 4th of December. And then for those who would want to get in touch with us, Tapio can give us the rest of the details. We've got a Facebook page and we're also on Instagram. And our mobile number, I'll give it out, is 078 78 73 277. I'll repeat that 078 78 73 277. So you can get in touch with us on those numbers, and then we can screen for those who will be eligible for the operations.
All right. Thank you so much, Doc. Maybe for those who missed it, it's 30 November 24th of December 2020 at Harare Central Hospital or Salumugabe Hospital, as it is called right now, right? Okay. And then Taps, maybe for contact details, would want to know how can people get in touch with Child that they can get the help that you're offering. Tapio? Okay, he's gone. He's having problems with his. Anyways, Joe, thank you so much for coming to the program. We really appreciate your time. We understand that you're a busy person, and you know, as a medical professional, you've got a lot of people to attend to. But you had to come. You find time for us. We appreciate that. We don't take that for granted. Thank you so much for getting the show, and may God richly bless your work. And those that you are going to operate on, may they heal fast and may they grow up well.
Thank you very much, Lovejoy, and thank you very much to the viewers and listeners.
All right. Have yourself a good day. We hope to catch you again on other programs if we need you.
Thank you very much.
All right. That being the program, me, the president, today we had Dr. Luxton Jokonya, a neurosurgeon was Hydrocelaphus. They are running some surgical camps from 30th November to 4th December 2020. It's a hospital. You can get in touch with them. We'll provide the details later on. And with you as well, you were thinking about him growing up with the condition. That said, my name is Lovejoy Jokonya. Let's chat again on the program and we'll catch you again next time. God bless.